The role of the immune system is to protect against diseases or other potentially damaging foreign bodies. When functioning properly, the immune system identifies a variety of threats including viruses, bacteria, and parasites, and distinguishes them from the body's own healthy tissues. The immune system normally guards against germs like bacteria and viruses. When it senses these foreign invaders, it sends out an army of fighter cells to attack them.
But what if the immune system didn't function properly? Normally, the immune system can tell the difference between foreign cells and your own cells. In autoimmune disease, the immune system mistakes part of your body, like your joints or skin, as foreign. It releases proteins called antibodies that attack healthy cells. Getting a diagnosis can be frustrating and stressful. Often, the first symptoms are fatigue, muscle aches, and low fever. The classic sign of an autoimmune disease is inflammation, which can cause redness, heat, pain, and swelling. Doctors don't know exactly what causes the immune system misfire, yet some people are more likely to get an autoimmune disease than others. It is more related to genetic factors. There are more than 80 types of autoimmune diseases, and some have similar symptoms.
The common and most frequent types are rheumatoid arthritis, systemic lupus erythematosus or lupus, multiple sclerosis, and the inflammatory bowel disease. In rheumatoid arthritis, the immune system produces antibodies that attach to the linings of joints. The immune system cells then attack the joints, causing inflammation, swelling, and pain. People with lupus develop autoimmune antibodies that can attach to tissues throughout the body. The joints, lungs, blood cells, nerves, and kidneys are commonly affected in lupus. In multiple sclerosis, the immune system attacks nerve cells, causing symptoms that can include pain, blindness, weakness, poor coordination, and muscle spasms. In the inflammatory bowel disease, the immune system attacks the lining of the intestines, causing episodes of diarrhea, rectal bleeding, urgent bowel movements, abdominal pain, fever, and weight loss. Ulcerative colitis and Crohn's disease are the two major forms of the inflammatory bowel disease.
But how can it be diagnosed? There are many tests used for the diagnosis of these autoimmune diseases, like the ANA anti-nuclear antibody test. It is often one of the first tests that doctors use when the symptoms suggest an autoimmune disease. A positive test means that you may have one of these diseases, but it won't confirm exactly which one you have or if you have one for sure. There are other tests used like the antibodies test, the blood test immunoglobulin A, the C-reactive protein test, the complement test, the erythrocyte sedimentation rate, the endoscopy, and the colonoscopy.
According to the National Institutes of Health, up to 50 million Americans, more than 16% of the population, suffer from an autoimmune disease.